If you've got a bulging or herniated disc just like this in your lower back, it is true, it's never going to be the same as it was before. But in today's episode of the podcast, we're going to help you understand what is possible after you've had these herniated discs and why actually it really doesn't matter. As long as we do the right rehab, whether we've had a herniated disc or not, it shouldn't limit anything we want to do in the long term. So don't despair if you've had this diagnosis. It can feel like there's a steep mountain to climb right now as you're struggling in bed, not able to move out the house for more than 5 minutes, but there is hope, and with a solid plan you can get where you want to be to again. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape. We help people around the UK and all over the world fix their back pain from home and get back in shape for the long term. And most, if not almost all, of the people that have been members or patients visiting us in clinic are going to have some sort of bulging or herniated disc down there in the lower back, and most commonly L4-5 and L5-S1 segments. What do we tell them? What's the prospect going forwards? Well, today's video is going to explain all of that. What better place to start than actually talking about what a herniated disc actually is? So when we've got a nice healthy disc like this one here, we see that the central part, which is in the light gray, is the nucleus. That's the gel. Often in the jam donut analogy, this would be the jam. Round here, these layers, which you might be able to see, are the ligaments, and there's lots of layers of those, and they make up the annulus fibrosus, which would be the dough in the jam donut analogy. We're also going to talk about a water balloon analogy to help you understand this role of the disc and how it becomes injured. Whenever we have a herniated disc, although we're going to see pictures of bulges going backwards on the MRI, it is not the bulge necessarily that's the problem, although that bulge sometimes might be hitting on a nerve. It is the fact that we have damaged the annulus fibrosus, these layers that hold the fluid in place and provide the fundamental mechanism for this disc to work. If we think about this for a moment like a water balloon, with the annulus fibrosus, these ligament bits, the skin of the balloon, and the gel in the middle, the nucleus, which in this case is herniated, in the center where we've got the water, we have the annulus fibrosus holding that fluid in place. And so when we squash down on the balloon, it necessarily will stretch, just like all ligaments do. All of our ligaments, in order for us to bend any part of our spine, say the neck, for example, forwards and backwards, those ligaments must stretch and then spring back. That happens in all of our ligaments throughout all of our body in some degree or other. And different ones are going to have different capacities for this. But when it comes to the disc, those annulus fibrosus ligaments have the capacity to stretch and compress. So when we start to have this bulging and then herniation, it is that water is starting to escape or leak through these layers of annulus fibrosus. They've started out, some of the inner layers have been damaged so that it creeps backwards a little bit through those inner layers, but some of the outer layers are going to remain intact. And then onto this full herniation, where it's completely coming out the back, we can see that all of the layers down here have become damaged or torn, and fluid is moving out of the disc in response to the compression through that disc. The jam donut analogy is most easy to visualize this process as we squash or bite down on the front of the donut. We find that the jam squeezes out through weak pockets in the dough and comes out the back all over our fingers. We have to appreciate that the herniation is a point on a scale of disc damage. It can often start out as something more minor than this disc bulge that we see here and progress on to that full herniation as we continually do those same things that reinforce the injury in the first instance. But if we are successful and we halt that process by starting to do the right sort of things to help this disc recover, all of these disc injuries will go through their appropriate healing process. Just like any other part of the human body, your discs, the herniated ones, are going to be trying to heal every single day. The body knows there's damage. That's why there's inflammation, which is a problem in of itself, which we discuss in other videos. There's inflammation driving resources to that area to try and patch up those tears that are in the annulus fibrosus. It's going through this healing process. You don't actively heal the disc. It's happening automatically. No more than you heal something, for example, a cut or graze on your knee. It happens automatically. Where it doesn't is when we constantly pick the scab in the surface wound analogy, or constantly re-injure or re-aggravate those tissues that are trying to knit back together. The most important thing we can understand is that your body is doing this process. And while you may be struggling for months, even years, with this recurrent herniated disc, we have to acknowledge first that the body is intelligent. It is trying to move back towards that healing position. And with a little bit of education, we can stop impeding the progress that our discs are trying to make. When it comes to the spinal discs, The most important part we're thinking about in the context of healing is going to be the annulus fibrosis, this bit here. We're not really thinking so much about the nucleus because that's not really the thing that's doing the load bearing. It is the annulus fibrosis that's restricting and holding in place this nucleus as it tries to escape. So we're strengthening this ligamentous tissue, and there are going to be certain features that we need to be aware of when we think about herniated discs and the annulus healing. Firstly, just like all other ligaments, the annulus fibrosis has very poor vascular supply, meaning it doesn't have a very good blood supply, which means it's very slow for the nutritional processes or products to be provided to that area of the disc as it's trying to heal, and equally waste products drained away. Secondly, as you might expect, ligaments don't turn over rapidly. They have a slow metabolism, meaning unlike our skin cells, unlike our muscle tissue, these cells are going to go through their regenerative process, their cell division process, etc., repair process very, very slowly. Next, there is a degree of complexity to the structure of the annulus fibrosis. And so it is very common that in the early stages of the recovery process, there's going to be a lot of scar tissue, which is disorganized collagen laydown in and around that area that we have the herniation. And so that's going to take a long time to go through the remodeling process afterwards. And to a certain degree, this is going to be limited. And we're going to talk about this more later. The next couple of points are quite unique to the annulus fibrosis. And that is, firstly, that it is constantly under strain from dawn till dusk. We talk about this a lot in the channel. Unlike other injuries to other ligaments in the body, we cannot immobilize the back, nor should we want to for other consequences. We can't specifically take it off strain like we can with a wrist, a knee, an ankle, where we put it in a cast, or maybe use the other limb to carry out most of the load whilst resting the one that's injured. That just doesn't work because we don't have a spare spine. And because of this, partially due to very poor education around the back, there is recurrent microtrauma. Think of this like picking the scab. The only difference is our skin will remodel very, very quickly. So picking the scab and knocking it back to square one, it's still going to go through that healing process, and eventually, maybe over a fortnight or so, it's going to go through that appropriate healing. But in the discs, it's very easy to pick the scab, so to speak, and set us back to further than we were when we first injured that disc. These microtraumas are a big reason why this back pain starts, and then it's steadily find that the episodes get worse, they get longer, they get closer together, and we get more difficult to recover from because we keep on getting this microtrauma. It is, quite frankly, very rare that it is a significant trauma that is the first incident to the lower back. It is more common that we have this slow picture of recurrent lower back pain every year or every 6 months for many, many years, and it's just gradually getting worse and worse and worse. And finally, again, there is this lack of ability to protect the lower back specifically because we can't isolate it, because we don't have very good tools or supports for this region, particularly the L4-5 and L5-S1. It's not practical to brace this area. And so we require a lot of education to help start to understand the back so that we can create a little bit more in the way of protection. And this is something that is sorely lacking for most of your interventions. We might have a great treatment, we might get given some exercises, but the education component is so very lacking. And that's fundamentally one of the reasons why so much of the Back in Shape program, about 60% of the hundreds of videos, is around education and understanding your spine, so that with this education, we can better protect the area, reduce the micro traumas that we're having, so that we can get more consistency in the healing that's trying to take place in that herniated disc. Now, while the discs might have that disadvantage to them compared to other ligaments, they are still going to go through that healing process. And this is so very important to understand. Know that your disc is healing. Know that it's going to take some time, but the more you educate yourself around this topic, the more you can execute on certain principles of spine neutrality and spine hygiene, keeping that spine nice and neutral, avoiding unnecessary microtraumas, and protecting the areas effectively as we can really start to get some momentum taking place in the healing of that herniated disc. But Mike, my disc is never going to be the same again. It's been herniated. It's never going to look like that healthy one. And you are right, but this does not need to be a problem. And hopefully this next section is really going to hit this point home for good. Ultimately, after you've had this herniated disc, you're going to have that upper limit brought down slightly on what's possible for your herniated disc in terms of its adaptation, its strength, its attributes. But you have to ask yourself this fundamental question. Had you reached anything like the peak that was available before you injured your herniated disc? There is a significantly small number of the population that will have anything like the resources, time, effort, energy, money, etc. to spend on building the best possible version of themselves structurally, we're talking about here. And we liken this to a car. The human body has a certain upper limit to what it is capable of adapting to. These discs being specific examples of that. And if we liken this to a car that can go up to 220 miles per hour, most elite athletes might well be driving close to the 200 miles an hour. But for the vast majority, you watching this video right now, maybe you're just an ordinary person that doesn't particularly do any major activities. You might only have been driving that car, what's possible, your discs round at 30 miles an hour on a daily basis. Maybe sometimes you push them to 40 or maybe 50 miles an hour. The average athlete, the person that is recreationally, exploring certain sports, might well be pushing themselves to 50 to 80 miles per hour in terms of what is possible in these discs. But the simple fact of the matter is we're leaving so much on the table, and you need to be honest with yourself as to whether you have actually done anything before you've actually got this injury to improve and build the best quality to that lower back prior to this injury. And that should often reveal an answer that is no, I've not done anything like that. I have been driving around at 30 miles an hour, to go back to the car analogy. So while it's reasonable to assume that you will actually have this handicap on what is possible in your disc, you have no evidence to suggest where that limitation lies. Using miles per hour again in the car example, is it 100 miles an hour? Is it 150 miles an hour? Maybe 180, maybe 200, maybe you won't quite break 200. Maybe that's not going to be possible because you've still got that scar tissue on the back left-hand side of the L5-S1 disc, and it's just never going to be quite the same again. But the simple truth for so many of you, even if you've got a fraction of what is still now possible, albeit limited, you would be probably stronger and more capable than you've ever been in your life before this date. So sure, if you're an elite athlete, maybe you're partaking in powerlifting, or maybe high-level martial arts, you might well be limited to what you can do compared to your contemporaries who are also elite athletes without that back injury. But for the ordinary person who had never even scratched the surface with what was possible to put through their body in terms of stress and strain, and specifically those discs, the sky is really going to be the limit, even with that natural handicap that's going to come from the less than perfect disc that you will now have. But it's important to remember, this is after you've been through the healing, after you've been through the strengthening and recovery process. So to summarize, while that disc might not look perfect on the MRI again, it might still look a bit smaller than the surrounding ones, there might still be a little bit of bulge there, you have to acknowledge that that doesn't mean that it's not going to be capable of adapting significantly to the stress and strains that you put through in your rehabilitation and be able to carry you through functionally without pain through all of the myriad of different daily activities that you want to do. The reality is, even with that theoretical upper limit of what's possible brought down as a result of the herniation, you're never going to scratch the surface of what's going to be possible, even if you were to have a significant amount of time, effort and energy to dispose focusing on this one thing. The simple fact is that we've got families, we've got jobs, we've got other hobbies and things that will take away from the constant pursuit of this theoretical upper limit that you now have. So quite frankly, these structural limits, my disc is never going to be the same again, are only ever going to be limitations up here rather than down here. Now, I don't want to make light of the challenge ahead. Some of you guys are going to be really struggling. You've got a lot of back pain, sciatica, maybe you had injections and surgery and it hasn't worked. It might seem like a lost cause, but at least understand now there is no evidence to suggest that you can't be substantially better than you currently are. The only question, the unknown, is how far do you have to go through the rehabilitation process to get the results and the resilience that you need to allow you to compensate for this slightly less than optimal structure down in that lumbar spine. We need to have a strategy that we're going to follow, rehabilitation work that we're going to do and execute to drive that healing and recovery and remodeling process, which can continue to take place until we start to reach that upper limit of what's possible. But you do not know. There is no predictor that you can use to rely on other than to do it and see how far it takes you. So we've got 3 strategies, short, medium and long term, that will hopefully give you a little bit of guidance at the back end of this video. Hopefully at this point you're already feeling a little bit more optimistic. It's maybe causing you to question some of those preconceptions that you might have been given by other medical professionals. They've said, oh, you're never going to be the same again. Yes, they're right, but what does that actually mean? And hopefully now you have a better appreciation that it doesn't sound nearly as gloomy as you first thought. Don't get me wrong, in the immediate aftermath of these injuries, we need to focus on some element of relief-based strategies. So that's why we have one of the free routines that you can follow, back pain relief routines. And you can do some of those exercises to provide relief from stress and strain on this disc on a daily basis. But we also need to immediately start learning exercises like those covered in the core 5, stability-based exercises, spine control-based exercises, the exercises that we will use as the foundation to build and restore that integrity to our spine and use as directors of the remodeling that we want to take place in these bulging and herniated discs. We must be focusing on the foundational competence in these movements, often just with body weight to begin with, to get the choreography down, looking for aggravation-free repetitions of those exercises. And for more details on those particular exercises and the relief routine, check out the link down in the description and watch the videos after this one. Medium term, we're going to continue to push those strengthening-based exercises now with the addition of little bits of weight. It might be in the way of bands, it might be in the way of kettlebells or dumbbells, and it might progress onto, or will progress onto, the way of barbells on certain lifts, using primarily our squat and or our hip hinge as those load resilience builders. And again, these need to be performed and executed with perfect choreography, a neutral spine, and within aggravation-free reps, meaning that we are not causing pain in our back or a recurrence or exacerbation of the symptoms that we experience, maybe sciatica down the leg, while we are doing these exercises. Know that most of the change in this medium term is going to be the muscular system developing a suit of armor-like characteristic to protect that lower back more effectively. And yes, healing will be taking place, but not too much in this time frame around in the way of strengthening and remodeling of the discs. Most of this is early stage healing still taking place. Long term, however, we are going to be slowly scaling the load that we're doing. And over the months to years, make no mistake, as you increase the load that you're using, particularly on those two exercises, the squat and the hip hinge, you will find that the annulus fibrosus, the ligaments that stabilize these segments, not just in the disc, but the surrounding structures as well, will start to strengthen up. And this will happen in a significant way. And the longer you go between episodes of flare-ups, the better you will be, the more complete and continued that healing process will be. What you need here is time, steady increase in the load, and above all, consistency, week in, week out, month in, month out. And if you do that, your body will know that this is what is demanded of it. It will know that it needs to change, and it will change. If you follow this process, focus on getting it right to start with in the early days, progressing steadily over the short to medium term, always mastering that technique and always operating within those pain-free ranges. And you scale the load that you're using consistently over the long term, you're going to do fantastic. Hopefully, this little message, the realization that yes, that disc is never going to have the capacity, the potential that it had before, but that even with the hard work that we've just discussed, you're never going to get close to the theoretical upper limits of what is now going to be possible for your specific discs. And that this doesn't need to be a real world problem that you ever face if you correctly rehabilitate over the long term. I do hope you found this video helpful. It's been a bit inspiring and maybe perspective shifting as a result of going through some of this material. We've referenced in the article a number of research articles with a little bit of description that you might find interesting on healing and discs and that kind of stuff for further reading. But remember, if you need any more support with this kind of stuff, you can always check out the many resources we've got on the website, backinshapeprogram.com. And if you need more help with structuring your rehab work and getting support along the way, you can check out the membership at Back in Shape Program. If you know someone else who's struggling and they're feeling pretty despondent, they've had a number of maybe MRIs or consultations and they're not really going anywhere, share this video with them to give them a little bit of hope that they too can do much better than they currently are right now if they just start doing the right sort of stuff. Thanks so much for watching. Hope you found this helpful, and we'll see you in the next one.